Hello everyone, I am Thanapat Sowankun and I am grateful for the opportunity to share our idea about statin. The cholesterol lowering agents should be OTC status. I will start by telling you briefly what is the statin and OTC, then we will look at over-the-counter and prescription statin available of statin. After that, we show you the research article about OTC statin and I will explain what we got from the research. Finally, I will give you our opinion, that is, statin should be OTC or not. I shall begin by introducing the statin drug. Statin is 3-hydroxy-3-methylbutyryl coenzyme A or HMG-CoA reductase inhibitor. Is a lipid lowering drug by inhibit HMG-CoA reductase, a liver enzyme that synthesizes cholesterol. Statin, for example, such as rovastatin, simvastatin, pravastatin, atorvastatin. There are indications for treating hyperlipidemia. Mechanism of statin can lower cholesterol in the blood by inhibiting HMG-CoA reductase, resulting in reduced conversion from HMG-CoA to mevalonate, in which mevalonate is converted into cholesterol. When mevalonate decreases, cholesterol decreases accordingly. The use of statin also has side effects such as myositis, rhabdomyolysis. In addition, statins can also pass blood-brain barrier that causing insomnia.
Let me introducing you what over-the-counter drug is. Over-the-counter drug is the drug that do not require doctor's prescriptions, can bought off the shelf in stores, and regulated by FDA through OTC drug monographs. OTC drug monographs is a kind of precise book covering acceptable ingredients, doses, formulations, and labeling. Monographs will continually be updated, adding additional ingredients and labeling as needed. Product conforming to a monograph may be marketed without further FDA clearance, while those that do not must undergo separate review approval through the new drug approval system. Okay, let's see which country that statin is available over the counter. In United States and the rest of the world, statin are prescription drugs, but in United Kingdom is the first country to provide non-prescription statin, approved in 2004. Allow low-dose simvastatin pill to be sold behind the counter, which require the buyer to talk to pharmacists first.
The research article, as you see on this slide, let's be with over-the-counter statin are warm, considering in primary prevention of cardiovascular disease. The benefit mean this slide reduce 10-year risk cardiovascular event. The 5% 10-year risk cardiovascular event rate in the possible treated group of the study reduced 33 in the endpoint p-value 0.01 for patients for 5 years. LDL cholesterol difference of 23 mg per deciliter. Disadvantage: critical in the responded way than category as purchase use, purchase non-use, or non-purchase use, depending on their behavior, but the use only meets all label criteria. Limitation: 94% considering their general practitioner And the paper is monitoring of patient with liver disease, heavy alcoholic consumption, or chronic hepatitis.
Yes, the second research I will present to you is a customer use study of over-the-counter lovastatin. Let's present the 3,316 customer divided to group is a 2,111 is a non-processor and 1,205 is a processor and have a 1,061 person in a 1,205 took more than one dose of the drug. Okay, me show you what about we got from this study. I will talk about three topics: advantage, disadvantage, and limitations. First, for advantage, the lovastatin can make the people prevent coronary heart disease, and the user can self-manage LDL cholesterol over time. And the third, this study encourages the therapeutic lifestyle change such as dietary, exercise. Is a disadvantage. First, some user had the current liver disease and increased risk of myopathy, and some user did not adhere to label benefit, and some user had a current contraindication such as liver disease. We moving to the limitation. The first one, customer must know their levels of HDL, LDL, and triglyceride, and some user can consult with the professional healthcare regarding cholesterol management. And in this study, don't have the possible group to compare with background rates for the adverse.
The third review of research article is topic a cost effectiveness analysis of over-the-counter statin. This is the method is divided in three groups that you can see in this slide, and the population they have aged more than 20 years. And this article is separate of two benefits and one disadvantage. Let me talking about benefits of this research. First, OTC of statin highly cost effectiveness option to improving population health. Second, reduce risk of coronary event, stroke or coronary heart disease. And about disadvantage, increased side effects of statin such as rhabdomyolysis, hemorrhagic stroke, and muscle pain.
Next, paper 4. Impact of a policy allowing for over-the-counter statin. Aims of this study is to examine the impact of the recent policy in Great Britain that allowing patients to purchase over-the-counter statin, OTC, 10 mg of simvastatin. Method is analysis of adults aged more than 20 years old in the nationally representative 2006 health survey for England. And there are some eligible criteria for OTC simvastatin. 1. Individual eligible for OTC simvastatin. 2. Individual who should be referred to a general practitioner because of high risk of coronary heart disease or have contraindication for statin. 3. Individuals who presumably do not warrant statin therapy. And the result, 44.1% met the criteria for referral because have coronary heart disease risk. 9.7% were eligible for OTC statin. 46.4% 0.1% did not meet the eligible for prescribed OTC statin therapy. The proportion of individuals using OTC statins among eligible for them was low and comparable to that in the overall population, 0.2%. So, this policy have pros and cons. Pro is increasing the load of patients to medical decision and decreasing the load of physicians. But there are cons. This policy did not achieve in target group who have moderate risk of coronary heart disease. 2. These people have several limitations such as short-term frame 2 years, and the information regarding the use of OTC statin is self-report and may be affected by legal bias.
We are now nearing to the end of our talk, and at this stage, I would like to run through my main point again. From first study that I had shown you, I will summarize the advantage of using OTC statins. Statin can reduce 10-year risk score and prevent coronary heart disease. And OTC statin has high cost effectiveness. And using OTC statin can reduce role of physicians and encourage role of patients to manage their own lipid profile. And the last one is OTC can encourage patients to change their therapeutic lifestyle. But there are also have disadvantages too. The first one is increased side effect of statin. The second one is some patients had poor adherence. The third is some patients currently had contraindication to statin. And the last one is in one study it does not achieve in target group. In conclusion, the main findings of research articles are OTC statin have many of advantages, but it also have many of disadvantages too. In our opinion, we think statin should not be OTC status, even though statin can reduce 10-year risk score and prevent coronary heart disease. But we are concerned about side effects of statin and drug interaction of statin that may be dangerous for patients. So, using statin should review annually with lipid monitoring to check efficacy to adherence of therapy. Statin should be surveilled by doctor and pharmacists and should follow up patients every year. This is our opinion. And what about your opinion? Is statin should be OTC status? And finally, I would like to thank you Dr. Wilawat and Dr. Aruna for expert advice and encourage throughout these oral presentations. And thank you for all listening.